I'm Pertussis, but most folks call me Whoopin' Cough. Ooh!
Pertussis is a highly contagious acute respiratory disease caused by the bacteria Bordetella pertussis. It can cause serious illness and even death, especially in infants. The good news is that we already have the tools to beat pertussis in the form of an effective vaccine. The challenge for healthcare workers is to boost the uptake among the general population. There are an estimated 24.1 million cases of pertussis worldwide and around 160,700 deaths per year. In 2019, the CDC reported 15,662 cases of pertussis in the United States, but many more cases go undiagnosed and underreported. During an epidemic, such as in 2012, U.S. pertussis cases rose as high as 48,277. But again, this could have been just the tip of the iceberg. Pertussis is particularly dangerous to infants, especially those less than 12 months old. Approximately half of babies less than 1 year old who get pertussis need treatment in the hospital. But pertussis shouldn't be overlooked in adults and adolescents either. It's believed to account for up to 20% of prolonged coughing illness, and when left unrecognized or untreated, there's a risk of transmission to others. There are several risk factors that may contribute to an individual experiencing severe disease or hospitalization, such as asthma, obesity, and other pre-existing conditions. Overall clinical impression is the most accurate predictor of pertussis. Adult patients with an acute cough of less than 3 weeks in duration or a subacute cough of 3 to 8 weeks should be checked for the 4 key characteristics that indicate pertussis. Pertussis can be treated with macrolide antibiotics in the early stages of disease. However, it's important to bear in mind that the treatment of disease with antibiotics does not lead to improvement of clinical symptoms. When it comes to pertussis, prevention is the best defense. A vaccine exists for pertussis. However, vaccination among adults in the U.S. is still relatively low and needs to be improved. There are 2 types of pertussis vaccine, the Dtap and the Tdap. Dtap is the diphtheria and tetanus toxoids and acellular pertussis vaccine for infants and young children. And Tdap is the tetanus and reduced diphtheria toxoids with acellular pertussis vaccine for adolescents and adults. Following vaccination, regular boosters are needed as pertussis immunity wanes with time. It's especially important to offer pertussis immunization to those who are at higher risk of contracting pertussis. For pregnant women, the ACIP recommends administering any time during 27 through 36 weeks gestation to promote passive antibody transfer to the infant. As with many vaccines, there are some common reactions reported with Tdap vaccination to be aware of. And there are some persons who may not be suitable for Tdap vaccination. It also may be contraindicated for anyone who had a severe allergy to a previous vaccine component. There are things we can do to increase the rate of vaccination in adults. One suggestion is to offer Tdap at the same time as a yearly influenza vaccination. But assuming the patient is eligible, Tdap could really be offered anytime they are in the office. The important thing is that you remember to offer it to keep their vaccinations on track. Healthcare workers should mention to patients all vaccines they recommend during a visit. This makes it easier for patients to understand what they need and when. It's also important for healthcare workers to debunk the myths about the vaccine. For example, the Tdap vaccine is inactivated, so it can't cause pertussis disease. Also, Patients can be reassured that Tdap vaccines do not contain thimerosal or other preservatives. Pertussis can be serious, but we have the tools to beat it. Healthcare providers, this is a call to get vaccinated and share your knowledge with your patients.